Let's have a look at another one that's really good for working on gluteus medius. This is an important one for us. Gluteus medius is so important for helping to stabilize the hips. We're going to start here, the legs, in a somewhat externally rotated position. We're going to use, we have a look down here at our hands, okay? We're going to use our thenar eminence, this nice fleshy part here on our thumb, to keep our thumb adducted again. And we're going to bring that nice fleshy part of our thumb right down here onto the lateral border of the calcaneus here. That's all we're doing, is just hooking onto it. We're not grabbing it, we're not grabbing the whole thing around the heel. We're just hooking just this border of the heel, and that's it. So we're using our thenar eminence, this fleshy part here, just to hook right onto that. And that's going to be our whole movement. No gripping here for the heel at all. Okay, so let's have a look now at this. Okay, she's starting here in external rotation. Then I'm going to tell her to roll her knees in toward each other. I want a little bit of internal rotation along with a little bit of abduction. Not all the way out as far as she can go, but more into a fairly functional position. So just a little bit, maybe shoulder width or slightly wider apart. Okay, so we're going to start here, and I've got my support here right on the lateral borders of the calcaneus. Turn knees going toward each other, push your heels apart, and now she's also going to sit up. Go ahead and sit up. Now when she sits up, I need to lower my hands in the water. I don't want her to end up in a V sitting position. Can you let that pelvis drop down again? I don't want to end up like this in a V sitting position. I'd like her to end up here in a long sitting position. Remember that just like all of our exercises here, we can make this easier for our patient by using a more proximal manual contact, which will give us a shorter lever arm. So here we are, giving some nice resistance here on the gluteus medius. How you doing there? Gluteus medius working? Yes. Okay, these are hard ones and really good ones for gluteus medius. So you're going to continue to give some resistance. I'm trying to adduct her legs. She's trying to push out with those heels nice and firm. Okay, now if we want to challenge her a little bit more, we're going to add a challenge here for gluteus medius along with the trunk. So I'm going to start shifting her forward and backward. Good. Tip her a little bit to one side. Shift her forward and backward. So now she has to work her trunk and gluteus medius, work those hips a little bit more dynamically. If we want to increase the challenge on this for her, we take her arms out of it. So we ask her to cross her arms over her chest. Okay, bring them nice and tight to her here. Now she has to work a lot harder. So we do short, fast, smooth, keep pushing those heels out. That's it. Okay, okay. She's not looking happy now. Okay, nice and fast. That's it. Good. Push. That's it. Excellent. These are great exercises. Good. And rest. Okay, great.
Cool.
Very cool. Very cool, isn't it?